Welcome back. This coming week marks the 6-month anniversary of abortions resuming here in Wisconsin. Abortions had stopped here due to a dormant state ban after the U.S. Supreme Court struck down the precedent set by Roe v. Wade. Now, in Wisconsin, a group of doctors sued to have that local abortion ban thrown out, and they were successful, with a Dane County judge ruling that the current state law only applies to feticide, not consensual abortions. With that decision, Planned Parenthood of Wisconsin resumed abortion services in Wisconsin last September. Now, the group's president, Tanya Atkinson, sat down with Braden Ross ahead of the upcoming half-year anniversary.
6 months out from when we started doing abortions again in Wisconsin, but I want to go back even further. I want to go back to Roe's overturn. Tell me about what that day was like for you.
So for a number of months, the team had been developing an operational plan to ensure that, we could do everything in our power to work with partners across the state, partners across state lines, to do everything we could to help people get to other states to access safe and legal abortion. When the leak came out, it was clear what the decision was going to be, and believe them when they tell you who they are. So the plan had been in the works for some time. And when the ruling came down on a Friday, a date that they had added that wasn't originally on their calendar, when the ruling came down on a Friday, our attorney called our health center staff and told them to stop immediately providing care. And that was in the morning. And there were, between Friday and Saturday, 50 plus patients that had been scheduled to have an abortion. And the team had to go out into those waiting rooms and tell these women, these people who needed an abortion, that the decision that they had made was no longer theirs to make.
So let's fast forward a little bit through the rest of that year. Obviously, we talked about the challenges you were facing, but when you finally get to September, a month before that Dane County Circuit Judge had brought their decision down, and you make the decision, we're going to start again in Wisconsin, even though we haven't technically seen this all the way through yet. What gave you the confidence, and what went into that decision to start the procedure again at 2 of your locations in Wisconsin?
Yeah, our commitment was to restore access to abortion as soon as we had clarification, and twice the judge in Dane County had rulings before the final ruling had said that this was not, the 1849 law was not enforceable. And so that was the clarity that we needed to fulfill our commitment. So as soon as that clarity was there, the organization was able to resume abortion services in a fairly short turnaround time, because all of our staff that was providing care before Roe fell, very lucky that almost every single one of those staff members stayed on the team, and they were either driving to Illinois or they were, adding services at the centers across the state, or, traveling to other centers to provide family planning care. So that's how Planned Parenthood Wisconsin was able to maintain its commitment to restoring as soon as possible once those rulings came through.
Monday will mark 6 months since that decision was made. How have the 6 months been?
So when we announced the decision to resume services, the appointments were filled within 24 hours, and our appointments have remained filled since that time. So it's clear that care is absolutely needed by women across Wisconsin, and they should be able to access this health care in their home state.
Talk to me about that latest challenge. You're asking the Supreme Court to find this law unconstitutional as a whole. Tell me about that.
Yeah, so that's really the second part of our commitment, is after restoring access to abortion care, we want to protect that access. And so we're asking the Supreme Court to answer a very specific question. Does the Wisconsin Constitution protect the right to bodily integrity, autonomy, and self-determination, including the decision of whether and when to have a child? So answering this question really necessarily includes asking the court if Wisconsin's Constitution protects access to abortion care and a healthcare provider's right to provide this care. So we've asked them to take this question, and we believe the answer to the question is yes.
Since this has started up again in Wisconsin, what do you think people should know about how it's gone and the future of abortion in Wisconsin?
Yeah, I think one thing I would say is we look at the very chaotic landscape across the country. The question that we are posing has resulted in a lot of yeses across the country to to secure access. Meanwhile, a lot of states still do not, the women of those states still do not have access to abortions. The other thing that I think is important for people to know is that during this entire time, even when we had to suspend abortion services, all of Planned Parenthood Wisconsin's 22 health centers across the state remained open, providing the full breadth and depth of services, of course, except for abortion when those services were suspended. Vasectomy services were added in Milwaukee, and sometimes with all of the information that's coming out across the country, it can be very confusing for people. And the care, the breadth of care that Planned Parenthood Wisconsin provides is really essential for people's health and lives. So we want to make sure that in all of this, people understand that Planned Parenthood Wisconsin's open, and if you need health care, we are here for you no matter what.
Braden Ross sitting down there with Planned Parenthood of Wisconsin President Tanya Atkinson.